Hello, my name is Stacy Williams, and I'm going to do a presentation on cultural awareness in healthcare. Objectives. At the end of this class or presentation, the student will be able to identify cultural aspects, define holistic care, and demonstrate an understanding of the three ethnic groups that I have chosen to talk about. Before we begin, I've presented a case study just to see if you have a working knowledge or basically if you're culturally competent with caring for a Hispanic patient. I'm going to read the case study and you can follow along, and then we're going to take about a 2-minute little break, and you can write down your answer, and then when we come back I will go to the answer, and then I will read to you the best answer that would go with this case study. A 45-year-old Hispanic female, Mrs. M, with a 3-year history of squamous cell cancer of the cervix, presents with severe pain in the perineum. The patient lives at home with 6 children, ranging in age from 5 to 18. She speaks little English. How might the nurse obtain a thorough pain assessment? And secondly, what aspects of pain assessments should be included? So let's take that 2-minute break, jot down your answer, and then when we come back, I will go over the best answer for this case study. Answer. The use of a skilled medical translator is imperative, not one who is a family member or a member of the patient's social circle. And there is a reason for this. It is especially important when confronting pain and potentially embarrassing disorders involving the genitalia. Also, if using family members, they may translate liberally, basically inserting their own hopes or beliefs rather than the patient's. A medical translator will understand the terminology and will not withhold information to protect the patient. Furthermore, asking the family to translate adds to their responsibility, adding sources of stress. The pain assessment should include the location, intensity, quality, and pattern of pain. Aggravating and alleviating factors should also be assessed. So the main thing here is when you come across a patient that basically has a communication barrier, or there is a communication barrier because of their ability to speak English that's not fluent, then yes, you would get an interpreter. And most hospitals do have basically a 1-800 number or someone who can interpret for whatever language they may speak. And that is the best thing to do, is to get a medical translator, because of just what was explained, is because family members may not basically tell them exactly what you're saying because they don't want them to know about how severe the illness may be. But using a medical translator, the information will be transcribed or basically translated to the patient as to what the provider or the nurse has told them what has occurred or what the problem may be. The United States have a population that consists of different races and cultures. As the population increases and cultures are introduced, the nurse must have a knowledge of cultural diversities. All people should be treated with human dignity regardless of their culture, race, gender, creed, religion, sex, and sexual preference. As nurses, you're advocates for patients. You're an advocate. Basically, you're helping the patient by collaborating care among physicians and other disciplinary teams to manage their care. But all at the same time, you have patients that their autonomy, which is their ability to make decisions regarding their care, is often jeopardized. And that's because maybe that there's a knowledge deficit and the patient says, hey, I just want to let the doctor decide because he knows what's best. Well, they have a right to decide the care that is provided for them or the care that's needed for them. They have that right to have that input, and that's what autonomy simply means. They have the right to make a decision in regards of their care or the procedures that are needed. They have a right to decide on if they want it and if they even want that particular physician to provide that care for them. Holistic care. You must provide a holistic care, and that's basically treating a patient as a whole when providing care. And providing care as a whole simply means addressing that patient mentally, physically, and spiritually. Prime example, a depressed patient may have experienced pain and gastric discomfort. Well, instead of just addressing their depression, that patient also has some other issues or other symptoms that come along with being depressed, which is pain and gastric discomfort. A good nurse would address all the symptoms that may accompany this condition. So that's basically what holistic care means. And when you're treating patients of different cultural background, you must treat them with a holistic care. Instead of just one thing, you have to address them in each way, physically, mentally, and spiritually. Human dignity. Human dignity simply means to respect for a human's worth, their beliefs, their free will. Dignity is shown through cultural awareness, client education, support, and respect. Dignity is shown through cultural awareness, client education, support, and respect. And a lot of cultures, that's what they believe. I mean, for you to have a working nurse-patient relationship with them, you must provide them with dignity, and that simply means that you're aware of their culture and you show that you're sensitive and you respect what they believe instead of trying to change what their beliefs may be. I have a site from Masters in 2005 that suggests that patients are shown dignity when they have the empowerment over their own care, which simply means autonomy. That shows dignity, that you're giving them the opportunity to decide on the care that they want or the care that they feel that's needed for them at the current time. All right, we're going to take a little moment to match the following. Shouldn't take but just a minute. You won't have to pause your slides, but we have 3 words that we would like to match up with the definition. Autonomy. Autonomy simply means, and I'm sure you know the answer to that, autonomy is to basically decide on the care to be rendered. Holistic simply means providing care as a whole for an individual, spiritually, physically, and mentally. Human dignity, just as we said before, treating with respect. Okay. Common cultures and beliefs. And I have some definitions listed below that will help along the way, that you will see throughout, that would be helpful in knowing the definition of these words, because sometimes they may seem a little confusing or run together. But culture is defined as the behaviors and shared beliefs among a group. Okay. Ethnicity, that simply means groups of people who are classified, the word classified, according to common racial, tribal, national, religious, linguistic, or cultural backgrounds. So an example of ethnicity would be African American or Native American. Those are considered ethnic groups because we're talking about a classification. Cultural diversity. Cultural diversity is a range of cultural differences among individuals. So that simply means just the community as a whole. We have different cultures, and different beliefs. So that just simply means cultural diversity, a range of different differences among individuals. And to be culturally sensitive, that is the behavior in individuals to feel or convey the uniqueness or culture of a group of people. So basically, you're being sensitive about that group. You're not trying to change it, but you want to become aware of their cultural beliefs. You want to become you're trying to be sensitive to what the beliefs may be. Okay, the first ethnic group that we're going to talk about, Latino. With the Latino, according to the U.S. Census Bureau, the Hispanic Latino group is the largest and the fastest growing cultural group in the United States. In 2010, there was approximately about 50.5 million people of Hispanic Latin origin in the United States, an increase of 43% since the start of the 21st century. Hispanics are affected by a number of diseases such as cancer, alcoholism, drug, obesity, hypertension, diabetes, adolescent pregnancies, dental disease, and HIV. When teaching or discussions are made in Hispanic families, they basically want this done because as a whole, they want everything discussed among the family because with the Hispanic culture, they believe in being very supportive. But usually when a decision needs to be made, it is usually made by the male or elderly authority figure. So keep that in mind when you're treating a Hispanic patient or Latino patient, that when it comes to their care, they believe in everyone knowing what's going on because of the support that's needed. And usually all this is addressed toward a male figure or the elderly authority figure. Even if it's something wrong with the female, usually the decision usually comes from the male on the care that is to be provided. Also recognize that Roman Catholic religion plays a large part in a lot of the Hispanic population, especially when you talk about contraceptive abortions and family planning. The Catholic religion is very strong among the Hispanic population. As far as their health practitioner use, still have some beliefs of use of healers, and they have basically ones that communicate with the dead to cure illnesses. So that's still a cultural belief with a lot of the Hispanics. As far as common health beliefs and practices, they utilize the dermabrasion, candling, and cupping. For example, if you may have a Hispanic patient to come in and you notice that their back may be bruised up, you might want to question that instead of jumping the gun and thinking that that individual may have been abused or beaten. They do believe in cupping. Their belief in fate and luck, or other powers beyond control. They also believe, for example, if someone's in the hospital and they're sick, they believe in treating sicknesses with juices and fruits. So you may have a patient that may have a flux of family come in with a lot of fruits and vegetables and food. Well, that's their cultural belief. They believe in basically, if you're sick, that you need food, hot and cold foods. They believe health is balanced by 4 body humors. Blood and yellow bowels are hot. Black bowel and phlegm are cold. So basically, they believe in cold, hot food therapy. Next, we have the Asian. The Asian group in the decades following the 20th century Political and social upheavals in Southeast Asia. Almost 750,000 people of Asian Pacific Islander origin immigrated to the United States. As of 2010, more than 17.3 million lived in the country. The religious background will consist of Buddhism, Confucianism, Taoism, and Phi. Their learning style is passive. You may see a lot of head nodding, but that does not necessarily, those are mixed signals, because that does not always necessarily mean that they understand what you're saying or agree. Basically, just nodding of the head simply means that they avoid being disruptive and will agree to what is said as to not being offensive, especially with help toward healthcare providers and nurses. So you have to be very mindful of that and make sure that they understand what you are talking about or what you're trying to teach them, and make sure that you're not getting mixed messages that they understand when they really do not. But it's simply because they are passive. Their learning style is a passive. Decision making in a family affair, especially male authority figure, when deciding the best solution for a situation. Once again, they believe in the male authority figure, making the decisions on health care, procedures, things that need to be done as far as immediate decisions to care for a loved one. The male authority figure. Also keep that in mind also. I have presented a slide as far as health practitioner use. The Asian group, they have respect for the use of medicine and professionals in the medical field. Common health beliefs and practices. They continue to believe in utilizing traditional healing, such as natural medications with acupuncture, acupressure, massage therapy, and coining. They also believe in the continuing use of yin yang. Yin illness are considered cold and should be treated with yang, which is hot food. Yang illness are considered hot and should be treated with yin, which is cold foods. So you have to kind of be familiar with that when treating an Asian patient on their cultural beliefs. The next ethnic group that we have are African Americans. And the African American culture is the second largest ethnic group, constituting 14% of the United States population. Of course, the average lifespan of Black Americans is shorter than that of the white Americans due to former's high death rates from cancer, cardiovascular disease, cirrhosis, diabetes, accidents, homicide, and infant mortality. Due to present high percentages of female single parents, it is imperative that the healthcare provider acknowledges the dominant role of the Black woman plays in decision making. Also, with the African American ethnic group, their strong ties encourages individuals to be treated by family before seeking care from nurses and other health professionals. And with this cultural practice, it often delays or the failure to seek treatment of a disease at an early stage. And usually, a lot of times when they come in, the disease probably has advanced to a right at terminal stage, because you know, for something that could have been treated maybe earlier. I have presented a slide as far as health practitioner use. Of course, the African Americans continue to believe in home remedies and advice from older female family members. They may not seek medical assistance until a condition is well advanced. because of the lack of trust of professionals in the medical system. And that comes from years and years of bondage and basically the treatment as far as, for example, like the Tuskegee Institute with basically research studies. So kind of have to keep in mind of that also. Common health beliefs. Warm environments may prevent suffering from bone and joint pains, which is and I've run into that a lot myself. A lot of homes that I go into it's extra warm because of the beliefs that if it's a cold environment, it will make the arthritis act up. That's one of the ones that I hear the most of. Medication may be deemed as too strong for their body and may use herbal remedies. Some continue to believe in the supernatural, causes cures, causes problems and can be cured for health conditions. The clergy plays a large part in the African American group. A lot of them use their clergy as the liaison between health systems and the family and the community. And prayer is the commonly used method to treat health conditions. Native Americans. With the Native Americans, the U.S. Census Bureau has identified more than 5.2 million people who are members of the American Indian Alaskan Native ethnic group. The family and tribe are the most important, and it is not unusual for groups of 10 to 15 to come to the hospital when a loved one is sick. They tend to not live by clocks and schedules, and this must be taken under consideration when prescribing regimens, such as something that they must do routinely on a daily basis or a dietary schedule. Diabetes is so prevalent among the Native American population, and it is important to know that they usually want to claim an amputated body part for proper burial. So keep that in mind. If you're taking care of a Native American and for some reason an extremity has to be amputated, keep that in mind, that a lot of times that they will ask for that body part back because they believe in a proper burial, and that's their belief of a proper burial, that you are buried as a whole. The main cause of morbidity and mortality are heart disease, cancer, diabetes, and drug and alcohol abuse. In terms of human relation, the Native American views eye contact as disrespectful. I have a slide uploaded also regarding healthcare practitioners. As far as the Native Americans, they still practice medicine as far as local healers, and they use healers in the village. And most of the Native Americans use modern medication practices where it's available. But if it's something real serious, yes, they will seek assistance with modern medicine. But anything else, they usually go to the local healers. As far as common health beliefs, still use the medicine wheel, which is an ancient symbol used like a mirror to see things that are not normally visible or understanding things. The traditional tobacco is also used, and it is very important among the Native Americans because it is used for a lot of ceremonies and medical purposes. To the Native Americans, tobacco is considered a gift, and it is used to cleanse the air and the mind as well. And a lot of times you may, if you have a Native American, you may find tobacco strode all under the beds, but of the sick, and that's basically their belief that it will heal the individual. Okay, I have a question, and it's an ABCD answer, and just take a few minutes to look over the question, And let's see if you come up with the right answer. I will read the question aloud and we will go over the answer. A common health nurse provides information on diabetes in a culturally diverse area. When information is provided on diabetes, the nurse should A. Use and explain in healthcare terms. B. Make direct eye contact with each client. C. Provide literature in various languages. D. Address on a first name basis. Well, the best answer is C. Provide literature in various languages. If you go back and look at the question, it says that a community health nurse provides teaching in a cultural diverse area. So if you have a culturally diverse area and you're trying to provide information to basically everyone, then you don't want to have a lot of language barriers. So yes, you would provide pamphlets or literature in various languages so that everyone would be able to understand what you're out there teaching, because this is a community resource and you're trying to basically get information across. The use and the answer A, use and explain in healthcare terms. Well, no, that's not the best answer, because it's a culturally diverse area, and even people who can speak English fluently may not understand a lot of terms or medical terms and can misinterpret. B, make direct eye contact with each client. That's not the best answer. If you remember back, we talked about the Native Americans. They believed that was disrespectful, and that's not the only cultural group that believes that direct eye contact is disrespectful. The Asians, they also believe the same thing. So direct eye contact with everyone would not be appropriate. Some people may consider it, or some cultures consider it as respectful, but not everyone. And D, address on a first name basis. That's not the best answer. Everyone doesn't like to be addressed on a first name basis. They'd rather be called Miseries in their last name, which shows respect. So that would not be the correct answer. And once again, the correct answer would be provide literature in various languages. In summary, the care nurses must take, not stereotype, of generalized common characteristics of a group to all members associated with that particular group. When providing care, you must remember that to treat each person with dignity, but as an individual, because everyone's not the same. Even though they may be of the same heritage or cultural background, they're still different, and their care should be individualized. In order for nursing to provide more culturally sensitive and competent care, we must encourage a nursing population that more accurately represents our communities. So that's the reason why we are pushing for more minority nurses in the community, because this allows more cultural sensitivity among people that are being cared for. A lot of people may show resistance because they don't see a nurse or a healthcare provider of their cultural background. So that's why it's important that the minority nurses are pushed forth in the healthcare setting. As advocates in healthcare, nurses must treat patients with dignity. We're going back to talking about dignity, because to develop that relationship with that patient, you must show dignity and respect. When a nurse is not culturally competent, it could alter that patient-nurse relationship, because it just simply means that it simply shows that you're just not interested in their beliefs, in their culture. So by becoming or being culturally competent in caring for someone of another ethnic background shows that you respect what they believe, and that will build a respectful relationship among that patient and the nurse. If you have a patient that is that is of another ethnic background, and the best thing to do is to self-educate yourself, and to self-educate and become culturally competent on that patient's beliefs, so that you can provide the best care that you can for that patient. Well, that's the end of my presentation in regards of cultural awareness in the healthcare. I thank you for taking the time out to review my presentation, and thanks again.